Welcome to the Digital Healthcare Experience, brought to you by Taylor Healthcare.
Hello and welcome to the Digital Healthcare Experience podcast presented by Taylor Healthcare. I'm your host, Chris Civitaris, and today I'm joined by Dr. Rishi Sarna, Chief Clinical Officer at Backline. Prior to his current role, Dr. Sarna was a lead physician informaticist at Innova Health, MedStar Health, and New York City Health and Hospital. He also previously served as Chief Medical Officer for Transformative Med and has a background in pediatrics. Welcome to the podcast, Dr. Sarna. It's great to have you on.
Thank you so much, Chris. I appreciate it. And no formalities. Please call me Rishi. Thank you for the respect. But please call me Rishi moving forward. So thank you.
You got it. And today we're going to be exploring the many layers of telehealth. And I know this is a topic that we can spend hours and hours and days and weeks and weeks. But we're going to really focus a lot of our time on the patient impacts. We'll also explore on some of the provider considerations. And of course, it's very difficult to talk about anything in healthcare without talking about the regulatory environment as well. Everything telehealth today. So to start off, can you give us a little bit of background on the work that you're doing as Chief Clinical Officer at Backline?
Yeah, no problem at all. So, at Backline, the work I'm specifically doing is I'm, working with our development team. I'm also working with our sales team to kind of bridge the gaps of, what our solution can bring. So in a nutshell, what Backline does is it's not only a secure communications platform, but it also does provide a telehealth platform. It also does physician scheduling, on-call scheduling, helps with patient scheduling, kind of think of a Swiss Army knife, but kind of roll into one. The biggest thing we see in healthcare there are so many solutions. There are so many, for one headache, there'll be an app, another headache, there'll be an app, and another one. And the problem with this is that physicians and providers start getting pretty much, over inundated with all these solutions. And then on top of that, we have to see our patients. So what Backline's been able to do is that it's able to kind of pretty much, conglomerate everything into one. So where a physician's not having to open up multiple apps, it's kind of like a one-stop shop. And then my other responsibility is working with, potential clients and our current clients to, first of all, with our current clients to improve the platform, and then with potential clients to show how it can bridge the gap to improve their clinical workflow, and ultimately how they can actually have more time with patients. The biggest thing I always talk about is, we in healthcare always talk about burnout. Any doctor will tell you that if you are shying away from burnout, honestly, don't go into medicine. You're going to get burned out. You're going to get work thin. That's just the reality of it. It's like when you pick anything in healthcare, you're going to have to study. So if you think like, oh, I don't want to study hard, then don't go into healthcare. My biggest thing and what I'm trying to focus the company on is how do we decrease the burden on physicians? And the way you decrease the burden, the way these healthcare IT companies can do that is to make a clinical workflow more efficient. We're not telling them what their clinical workflow should be. We're just trying to make it more efficient for them by, decreasing the amount of tools they have to use.
Yeah, and obviously, telehealth, telemedicine it wasn't a new phenomenon when the pandemic arose, but the pandemic was certainly a compelling event that led to just a massive acceleration of telehealth usage and adoption. I'm curious, though, now 4 years removed from the start of the pandemic, how have you seen patients' perspectives or telehealth sort of in general evolve?
It's being on the provider side of it, being on the side of even implementing telehealth for hospitals and making them more efficient in that, I've only been on the patient side myself a couple of times, but I have seen it how my parents use it. My parents are in their, late 60s, early 70s. And, the way I try to approach telehealth from a provider standpoint is it's kind of the opposite of what, Steve Jobs said, on the iPhone. Remember when the iPhone first came out, he challenged his engineers. He's like, I want a 4-year-old to be able to pick this up and use it, right? In telehealth and medicine, it should be on the other end of the spectrum. We want our senior citizens to be able to seamlessly use it. Because if they can seamlessly use it, then the rest of the population can use it pretty easily well. So I've seen it where my parents have been using it more and more and more. And obviously there were definitely some technology hurdles. My parents still want to learn how to Uber. And I'm like, we're not gonna tackle that one yet. We're like, let's do telehealth first. And so I think from a patient standpoint, there's definitely been a huge level of convenience. It's imagine 4 years ago where telehealth was a thing where a lot of IDNs and a lot of clinics were experimenting with, and now their hands were forced to do it. Hospitals were being inundated with patients, ERs, clinics with people who had COVID, and then all these to the infrastructure of our healthcare system. We stepped up. I feel like we were a little late to it, but we still did step up. Where we're like, okay, well we can now do screening over a computer monitor. Now it's nothing ever beats the in-person, but if you came to me like saying, hey Rishi, I have COVID, I can look at you based on your effect, how you're speaking, if I can hear if you're congested or not. I'm like, you know what, you don't have it right now, there's no need for you to come in. So that's just on the COVID aspect. But I think more and more patients, especially in rural communities where you have that family that has to drive 50, 60 miles to get their family medicine doc for like a routine checkup, or something which is like, hey, my kid's got a cold. It's like, well, you know what? I can get on a screen now and you can save a ton of time. So I think patients are definitely adapting to it better. They're perceiving it better. They're wanting it more. Ultimately, we're never going to replace the in-person visit, but from the convenience factor alone, it's I think it's being definitely adapted. From personally seeing it, in my household, and then from the patients that we get feedback from our company, being like, hey, listen, this is a very, very convenient way of going by and seeking medical treatment.
Yeah, it's funny that you mentioned a 4-year-old and parents in their late 60s, early 70s. I have both, and I can tell you that the 4-year-old is just whipping around that iPhone, playing games. Apps,
Are you keeping a full set of hair with both? That's what I want to know.
I don't know. It's starting to gray on the sides and everything. It's just only a matter of time, I guess. But it's such a good observation. I mean, it's incredible to see how technology in general, the lens is always towards youth. It's how do I get Gen Z engaged? How do I get millennials engaged? How do I get, folks that are on the younger side of the demographic engaged? And here we are in healthcare kind of looking at the opposite, where how do we get folks that might not have had, as much of a penchant for technology across their lives to now embrace that? So I think that's a wonderful observation.
Yeah, of course, yeah. So do you only have one 4-year-old, or you have two 4-year-olds?
Thankfully, just one 4-year-old. My wife would say she's got two 4-year-olds. She's got my son, and she's got to deal with me. So it's a little different from her perspective, I'm sure.
I mean, I'm one to talk, man. I have like 800 bobbleheads behind me. So come on now.
I love the bobbleheads; are great. I think it's a great story too. You should share the context around that.
Yeah, this started a long time ago. One of my patients, the Phoenix Children's, as a thank you gift, gave me a Funko Pop, and I was like, okay, this is awesome. And then the nurses started telling other patients, like, hey, get Dr. Sarna a Funko Pop, actually at Phoenix Children's they'd call me Dr. Rishi, and then it just kind of built. But I'm not going to lie; these are not all from patients. I went down the rabbit hole. My brother got me the 1989 Michael Keaton Funko Pop, and being that generation, he is the greatest Batman ever. I don't care what anyone says. If you were born after 1980, like, he's the greatest Batman ever.
I'm with you 100%
that just led to another wormhole. And then I found out there was a Michael Jordan series of Funko Pops, so I had to get every single one of them. So the story started off really, you're very innocent, and now it's like the 5-year-old me came out, and I'm just like, I just had to buy everything. So
that's yeah. I once had somebody tell me that toys and boys' toys, they still have them. They just get more expensive as they get older. That's basically the only difference. So
yeah, exactly. So.
Well, jumping back into it, let's talk a little bit about the federal regulations surrounding telehealth. There have obviously been some massive changes. The Reader's Digest version, the most important highlights from your perspective in terms of what's changed this year and what we can see going forward.
Yeah, the Consolidated Appropriations Act, I think it's like Section 4113, actually extended the provisions they had into 2024. So I won't go into that, but pretty much when the COVID emergency, the pandemic started, they relaxed a lot of these rules. And we could honestly do like a 10-part, podcast series on this. We would probably have 3 viewers, if we went into it. It is extremely boring, but part of my job is to learn this stuff. So, like I said, we are a telehealth platform as well. So we want to make sure that we are helping our clients, comply to all the regulations. The confusing thing about this is they use two terminology. They use 2 terms, which are in my book. I don't know why they did it this way, but they just decided to make it more confusing. They use a term called originating site, and they use a term called distant site. What originating site is where the patient is located when they're getting telehealth services. That's called an originating site. And then you have something called a distant site, and that's where the physician or provider is located when they're providing telehealth. So why not just say where the patient's at or where the doctor's at? I don't know. I mean, for a while I'm reading this bill and I'm like, okay, what's an originating site? What's a distant site? So pretty much what they've done is through the end of 2024, right? A patient doesn't have to be an originating site. So prior to that, there were designated originating sites, right? Now a patient can geographically pretty much be anywhere they need to be. Now, the stipulation of that, you would think that, this would keep extending after 2024. Right now, the way the rules are written, after 2024, there may be some originating and geographic limitations. We just haven't gotten there yet. But that does not apply to mental health. So anything with like behavioral mental health issues, you don't need to be in an originating site. Why they use that term, I don't know. But that was the biggest takeaway. That was the biggest thing that providers were fighting for and patients were hoping for. Now, from the provider standpoint, right? Remember the distant sites, right? Through the end of 2024, all providers that are eligible to bill Medicare for professional services, they can provide distant site telehealth. I'm not going to get into it, but prior to that, you could figure out there were some limitations on that. So they did extend that. Now, the other thing that they did was they also expanded which practitioners can also provide telehealth. This is now being extended to occupational therapists, physical therapists, speech language pathologists, practitioners that do like diabetes management. They're not necessarily doctors. So that's been extended. That's helping too. In addition, they're also adding more mental health providers. So you don't necessarily have to be a psychiatrist or psychologist. You can be under other professions in that umbrella. And then there's a whole new array of CPT codes that they've changed that you can bill for. The list is about this long. Not going to go through them, but those are the main ones. Now, we are seeing that, they made this decision last year in around May or June. We'll see what they'll do in 2025. But those are the big key points that have come away from the extensions that they made in 2024.
It's pretty impressive to be able to distill everything down into something that's digestible.
You have no idea.
It's like you get politicians, lawyers, then members of the healthcare community kind of in a room, and that's not going to be very clear. That's recipe for disaster when it comes to being able to explain it to the layperson. So.
Absolutely. And I'm sure there's going to be someone listening like, no, that's that specific part. I'm like, hey, listen, I'm just giving it, that, remember that book in our generation, something for dummies. That's what I tried doing. Yeah. So I was like, this is, I'm not trying to dumb it down. I'm just trying to simplify it as best I can for everybody. Right. And, it's funny you did mention that we actually as a company, we did a full on webinar on this where we were actually very, very happy with the turnout. So that's something you can always find in, my LinkedIn page. We actually did a full depth in webinar of all the changes coming to 2024. So.
Excellent. Yeah. So as we think about 2024, virtually every single hospital system out there is striving to enhance accessibility to telehealth services, which obviously is a core pillar of their sort of access strategy in general. I'm curious,
Right.
could you discuss some of the initiatives and steps being taken that you're observing to make telehealth more accessible?
Yeah, it's the frustrating thing is on the physician side, and I don't think we do it on purpose. We are always complaining about, hey, I need the newest 4K monitor. I need a new microphone. I need this. I need that. But that's only one part of the equation. The other part of the equation is the patients. And I think a lot of times, and again, it's an oversight, but it's not a stuck up oversight, I should say, is that we forget sometimes that a large part of our patient population doesn't have the means to have, unlimited internet, unlimited data. We're making the assumption that someone has, they have a smartphone that, they can jump on any point, get on a telehealth call, that they can get on the internet, they have high speed internet. And that's the mistake on our end. So, even though the infrastructure is improving in a lot of hospitals, we're still not addressing the issue on the patient side. Now, I can't speak for what individual IDNs are doing, just because either they keep it close to heart or they're just not making it public. But we do know as physicians, a lot of IDNs do go out and they try to have classes on how to use your phone when it comes to telehealth. But again, that still doesn't address the issue of getting them the services they need. I did come across, a few organizations, for example, like Elevance Health. They're an insurance-based company out of Indianapolis. And it was very interesting what they're doing is they're actually, for patients that are eligible on Medicare, they're actually providing them phones. And which was very outside of the wall thinking, because obviously, the benefit for a company doing that is, if you think about it, if you have a patient come in that it can be addressed, like a routine visit can be addressed via telehealth, you're saving that patient, a visit from going to the ER or going to an urgent care. And we all know that's very, very expensive, whether you have insurance or not. And so they're also looking at it from their standpoint too, be like, okay, well, we could, get rid of this headache of all this unnecessary billing. So if we provide these patients phones for a routine visit, like a common cold, or even still, people think COVID's gone, or a COVID scare, or something else, or so you have a nasty gash, and it's like, does this need stitches? It's like, you know what, you're good, you don't need stitches, things like that. You're now providing them, the resources for that. So I was pretty blown away by Elevance Health is doing it, how they're going about it. Like I said, if a patient is eligible on Medicare, they'll send them the phones. They'll tell them the software to download, all that stuff. They'll give them tutorial what to do. This is not only unique to the United States, but Canada did this too during the pandemic. It was in the Greater Toronto area. It was a company called Phone Connect. And pretty much what they did was they called the general public to donate any of their old smartphones. And then they obviously, they erased the memory, replaced the SIM cards, and they gave it out to the public. So that's a very, very, very obviously proactive way of going about it. But we also know that, hospitals right now are operating still on razor thin margins. People don't realize that. And to expect a hospital system to do that, it's a little unrealistic right now, and frankly, a little unfair. But some measures I've seen some hospital systems do, when I've done, EHR implementations, whether it be Epic or Cerner or whatever, I've noticed that the hospitals which really take telehealth seriously, they'll actually set aside courses, or they'll set aside time where patients can come in, with not necessarily a social worker, but kind of like a patient coordinator. Hey, let's make sure your phone has the right specs on it. This is the app you need to download, or this is the link you're going to get. This is how you do it. So that alone bridges a gap where I've seen sometimes where again with my parents, they'll just get a link and they're like, what am I doing with this? So I think if you start with the bare bones, like, hey, you teach, you educate people, hey, this is the link you're going to get, or this is a app you're going to use, then that's a start. But ultimately, in my opinion, and I'm sure people will disagree, I think that, we do need to stand up more, as hospital systems, corporations, kind of like what Elevance Health has done. It's like, hey, listen, maybe we subsidize internet, because Elevance Health is working with the federal government in collaboration with Verizon, AT&T, T-Mobile, and Samsung to do this. So I was very impressed with that. I kind of think you were looking for a broad example, but that specific one came to mind. It just happened about a few months ago.
It's a great example, and to your point, it's a great example of how the healthcare ecosystem is made up of so much more than the providers that are actually potentially on the other end of that telehealth session. I mean, it sounds like you're describing almost a responsibility to the industry for providers and payers and large employers, and sort of take your pick across sort of that ecosystem of what influences the health and well-being of a patient.
Right. Absolutely.
I mean, and obviously any technology that helps patients in their daily lives, that increases their satisfaction, that increases their engagement, that's a pretty good sort of baseline, a pretty good foundation in terms of, will the technology take off, will it be productively used, so on and so forth. So I'm curious, along those lines, what kind of factors are influencing that satisfaction, that engagement among patients and telehealth services, and how can, whether it's providers or payers or other, sort of help improve that patient experience related to the telehealth landscape?
Well, I mean, we kind of touched upon it, my very, very long answer there for your previous question, but that patient satisfaction ultimately comes from what's the outreach, in my opinion, right? If patients are feeling like they're just being left in the dark again with this new technology piece, then patient satisfaction is going to be an ultimate low. We've known in the last, when I left clinical medicine to focus on healthcare IT, we know that physician satisfaction has been an all-time low because, you've been to the doctor 1,000 times, and it's to no fault of a doctor or nurse, but there are so many things that we have to do in an EHR that you as a patient feel like your doctor or your provider is just looking at the screen and not looking at you. And that's not because they're not interested, it's because there's so many things they have to do in that screen. And so that's something which, a lot of IDNs, a lot of clinics have taught their providers, like, okay, well, how do we decrease that, that burden on you, so you can actually be a better provider. So that patient satisfaction has gone up. Now, I will say, though, that when an IDN does switch to a new EHR, patient satisfaction scores plummet because now you're expecting a provider to learn a new EHR system and see their full schedule still. And then that's where
really, I mean, the education around those new EHR implementations have certainly gotten better, and it feels like providers are getting engaged much earlier in that process. But even still, that's a major shift for an organization.
Yeah, no, it definitely is, and and a lot of some IDNs can afford it, some IDNs can't. Being involved in this optimization process of it, the IDNs which actually will contract out physicians. There's companies like Remedy Health, things like that, where they'll work with physicians, be like, hey, we're going to bring physicians on site to coach other physicians how to do it. And the telehealth component is becoming a big part of that too. How do you coach your physicians? Be like, hey, listen, this is how you use telehealth. But then the better IDNs are, the ones that, and that doesn't necessarily mean more money, but the ones that are being like, okay, well, we have to make sure we bring our patients along the journey as well of this. They've really, really honed in the telehealth part because, when a new EHR starts too, is there are patient portals. There's all this stuff that patients have to learn. But the telehealth component, if you can, like I said, we had mentioned earlier, if you can even just sit down with a patient after every visit, be like, hey, listen, like, I'm going to send you a telehealth link. Do you have any questions? Make sure your video is running, this and that. Then patient satisfaction goes up to what we alluded earlier, that now patients are more willing to do it. Because if something's frustrating, you're just not going to do it, right? And so, and then that's the same thing also on the physician side too, because we also make the assumption, just because, we do have a specialty training, but, I always get the wrath of fellow colleagues. I don't think physicians are smart people, to be honest with you. We're not. We focused in on something and we got really good at it. And that doesn't make you smarter than anything, but, society sometimes thinks that because, we're doing something which, very few people do, that we're smart across the board. But you'll be surprised how, when it comes to technology, how slow some physicians are to that, including myself. I'm in that generation. I grew up with a cell phone, but there's always new technological advances where you have to kind of stop and learn. And when you're a full-time practicing physician, you don't have time. So if your hospital resource is providing you resources to get better at that, then the satisfaction score on the physician end and on the patient end is going to be phenomenal.
So how do you affect that? I mean, does the industry make progress on that front by a better education at the residence sort of phase of a physician's journey? Are there things that the industry is doing to make that more palatable to physicians in terms of that adoption and understanding of technology, particularly in the telehealth space?
Yeah, with residents, obviously, I don't have the statistics on top of my head, but it's, most residents are, they follow the standard. You graduate high school, obviously you finish college, and then you go into med school, and then you go into residency. So this generation of residents, you and I grew up with cell phones in our hands.
Right.
This generation of residents, they grew up with cell phone before they're out of their mom's womb.
I always say we grew up with cell phones in our hands, but we also grew up, having to dial, a collect call from a payphone to have your mom pick you up at the basketball gym too.
Yeah, exactly. Or if your mom was late, you were waiting outside. You had no
Right.
way of getting a hold of them. So when it comes to the usage of technology from this newer generation, that's never a worry for me. In fact, when I do these implementations and some of these residents will ask me questions, I'm like, "Are you serious?" I'm like, "You should be teaching me right now," type of thing. But what's changing now, where in my training versus training nowadays, is that attendings can actually supervise residents via telehealth now. Now, obviously, there are restrictions. You're not going to have an attending like supervising, a resident during like emergency surgery. But and that was one of the things that the AMA was hoping for, that there would be these extensions into 2024 as well when it came to the attending and resident supervision over telehealth. That was part of one of the things, the kind of all the different things we went through earlier. Those were extended as well. Now, a misconception is when an attending and a resident, even in person, right? Like, let's say you're my patient, I'm the resident, I walk in. The attending doesn't have to physically be there. They just have to be readily available, where if something does happen, I can go get them. Because realistically, that attending is also working with other residents as well. And the same thing with telehealth is that attending doesn't necessarily have to be there. They just have to be readily available. Now the ACGME, they went through, it's another one of those things where you and I could do a 10-part podcast series on every single, subspecialty and what their rules and regulations are for telehealth. But for example, like in the field of allergy and immunology, right? The resident and the attending, they have to directly solicit key points of an allergy and immunology, in person. Now they can also supervise that through a telehealth, but there are some limitations on that as well. It gets really, really nitty gritty. This is why, thank God that if someone goes into pediatric residency, they're only dealing with pediatric stuff. If someone goes into an ortho residency, they're dealing with ortho stuff.
Right.
Now, for example, in anesthesia, they're not going to allow telehealth stuff for that, right? An attending physician must be there with the resident and things like that. So, like I said, the pages on the ACGME website is 19 pages long, goes to every subspecialty. But the fact that in 2024 they are allowing those supervisions to happen is a huge game changer. The AMA like literally was screaming on top of a mountaintop, like, you cannot take this away from us, because during the pandemic this was clutch. And this was clutch from helping, ERs being inundated with people who didn't have COVID versus people who did. So that part of the training, that's completely new to me, right? I never had that. everything was in person. But now that you can have supervision via telehealth, that's changing from an educational standpoint too.
It's a massive game changer, and hopefully a force multiplier too to help solve some of those access problems, staffing problems. That has a lot of reach to it too. We've talked a lot about kind of where we are. I'm really curious about where you see this whole thing going. So as you sort of sit back from your expertise and think about what we can expect in terms of advancements and innovations, and where the platforms from a telehealth perspective are going, how the needs are evolving pretty quickly in terms of what providers are demanding, what patients are demanding. Where do you see the space going?
It's telehealth is one of those things now. It's becoming a buzzword, right?
Right.
Telehealth, along with AI, everyone's like, "Oh, what's AI doing? What's telehealth doing?" In my opinion, the ceiling has no limit. I never thought in my wildest dreams that they would allow supervision of telehealth of attendings and residents, but here we are, right? I will be blown away. Part of my background training was in surgery as well. We had discussed earlier, like, why was I crazy enough to do med school and dental school? Trust me, my Indian parents hate me for that to this day. But they're like, dude, just pick one degree and stick with it, right? Type of thing. But during the surgery world, when I was in that aspect of it, again, like I would never imagine like attending look at me from a screen and be like, oh, don't do that. That's not there yet, but who knows? It might be, right? 10 years ago, 15 years ago, we'd be like, oh, there's no way I can supervise you via video conference. I mean, 20 years ago, we were like, video conferencing, that was a thing from Jetsons, right? Or 30 years ago, whatever. Here we are. So I feel like there's no ceiling with that. But my concern, though, is that as we make more and more advancements in technology, again, we're going to increase the burden on physicians and providers. Like, hey, listen, I got the latest and greatest telehealth thing. All you got to do is just, put it up on your device and do it. And I'll tell you right now, providers they're blown away with the strides that healthcare technology is making, but they're exhausted with all the new things they have to learn. And at the end of the day, I mean, you have more and more physicians. I have more and more of my colleagues from med school being like, how do I do what you do? Like, I want to get into your space. And for me, like, I miss clinical medicine, but I also see the need to have a physician be the voice of other physicians and other providers. So my concern, though, is that I feel like all healthcare IT companies, their heart's in the right place, but we don't want to make it to a point where it gets so cumbersome where we're like, you know what, I don't even care about that. And it's, one of the reasons why I joined Backline was that, when you're in this space, you kind of have the luxury of looking like, okay, well, this company interests me, let me reach out. This company interests me, let me reach out. But when I saw what Backline was doing, we're pretty much trying to consolidate, 8 or 9 different applications into one, right?
Right.
We already have the EHR to deal with. And now if you're telling me, like, the analogy I give, when I'm trying to explain to people in non-healthcare, we all have apps on our iPhone or Android, right? You got your Sports Center app, you got your news app, whether it be, Fox, CNN, whatever it be, you got your weather app, you got your, Day of the Word app, right? But it's all in one device. Now imagine having a different device for each of those things I just named. Imagine me having a separate device for my ESPN, for my, my Lakers scores. Imagine me having a separate device for, what's the latest and greatest is happening in politics right now. Having a separate device for weather. I'm not going to do it, right? It could be the greatest app ever, right? Or the greatest device ever, but I'm not going to do it. But we consolidate everything on one screen. And that's what Backline is achieving to do. It's like, well, if we put everything in one, now you have less windows to open, less applications to learn. So that's where I feel like, healthcare IT needs to go. Are all companies doing that? No. But I think this is how you will decrease the burden, because if I read another article on physician burnout, I'm going to break my screen.
I'm going to get burnt out if I read another article about physician burnout. I think.
Yeah, exactly. Right. Exactly. So that's the direction which I see it in going. Like I said, it's a good problem to have when the sky, when the ceiling has no limit. but it can also cause a problem that you never anticipated. You can get a lot of pushback. So
absolutely. Well, any other closing thoughts? And also, where can our listeners go to learn more about the work that you're doing and the work that Backline's doing?
Yeah, you can just always go to our website. If you're not going to remember the URL, just Google Backline, and it'll pop up. You'll see all our work we're doing. On LinkedIn, we have a very good presence. Like I said, for the providers out there that want to know more about the CMS changes in 2024, we actually did a full on not a podcast, we did a full on webinar on it. And I would say podcasts are supposed to be fun, and webinars are just supposed to be they're supposed to be somewhat boring. And so that you can find that on. I've actually written a few articles on comparing telehealth, where it's going. Unfortunately, for those pickleball players, I do make fun of pickleball. Pickleball is not a real sport. So I definitely bash those people. I've gotten some friendly hate mail from other colleagues of mine.
You're stepping into the ring of fire there, picking on pickleball. That thing is taken off mad.
Either pick tennis or table tennis. There's no in between. So if you're going to shoot on a 10-foot rim or a 3-foot rim, just one or the other. Don't pick that 7-foot one. So yeah.
It's great.
But yeah, that's where you can find all our stuff for sure. So.
That's awesome. And I can't let you go. I know you're a big NBA fan, a big basketball fan. So I got to ask you, especially since we have, the chairman of the board of Taylor, Mr. Glenn Taylor, with his obvious connections to the Minnesota Timberwolves. Well, next time we have you back, maybe we'll do an NBA focused podcast here. We'll do an offshoot of the digital healthcare experience and just talk NBA ball. We'll see if we can get Mr. Taylor on too, and we'll.
Oh my gosh, I would love that. If you get Anthony Edwards on there, I'll make sure I wear my help in. So,
Most popular digital healthcare podcast ever recorded with Anthony Edwards.
Ever recorded, yeah. We're going to get 5 million hits with Anthony Edwards showed up on it. So yeah,
one can hope, one can wish. Well, listen, Rishi, this was a fantastic conversation. It was a great pleasure to spend some time with you, and I really appreciate you being here today.
Yeah, thank you so much, man. It's a pleasure being here, and I hope people enjoy what we talked about. We try to make it as fun as we could. So
absolutely, and thank you also to our listeners. If you enjoyed the conversation, please like, share, and subscribe to help us grow the show. And if you'd like to learn a little more about Taylor Healthcare and the digital healthcare experience, you can go to taylor.com/digital-healthcare. That's it for today. And until next time, this is Chris Civitarice wishing you health and good cheer. Take care.
Take care.
To learn more about Taylor Healthcare, please visit taylor.com/digital-healthcare. This podcast is for educational purposes only and is provided with the understanding that it does not constitute medical, legal, or financial advice or services. The Digital Healthcare Experience is produced by Naomi Schwimmer. Podcast music by Nicholas Bach.